Hello and welcome to a very important and pertinent issue that we are discussing today. I'm 𝗗𝗶𝘀𝗰𝗹𝗶𝗺𝗃. Today, if there's one issue that is singularly affecting billions of people around the world, it is stress that has taken chronic proportions over the time. If it remains unchecked, it singularly affects the physiological, emotional, and mental aspects of human health. Also, it has been found that it leads to the development of type 2 diabetes in cases where people are already vulnerable to diabetes. Today, we are discussing this linkage between stress and type 2 diabetes in our discussion, and I have a very eminent panel of experts to discuss this. I would like to welcome all our three panelists today. Dr. Rakesh Sahay is President, Research Society for Study of Diabetes in India. Also the Professor and Head, Department of Endocrinology, Osmania Medical College and Hospital, and Consultant Endocrinologist at the Sahay's Endocrine and Diabetes Center and Aster Prime Hospital, Telangana. I also have with me Dr. Sanjay Agarwal. He is Secretary General, Research Society for Study of Diabetes in India. He's also the Director, Diabetes, Obesity and Metabolic Diseases at the Ruby Hall Clinics, Pune, and Head of Department of Obesity and Diabetes at the Sahyadri Hospital, Pune. We also have with us Dr. Vijay Vishwanathan. He's President-elect of the Research Society for Study of Diabetes in India. He's Head and Chief Diabetologist at the MV Hospital for Diabetes, President, Professor M. Vishwanathan, Diabetes Research Center, Chennai. So I would like to open this discussion with Dr. Rakesh Sahay. Sir, how does chronic stress affect human health?
Thanks, Richa, for bringing up this important topic. Stress has today become very common, and as you can see, that diabetes also is increasing in significant proportions across the world. And today we have a huge burden of diabetes in our country also. And stress causes diabetes through several mechanisms. Chronic stress leads to increase in certain hormones like cortisol and epinephrine. These hormones have actions which are anti-insulin actions. You can say that insulin is the hormone which regulates the blood glucose levels. And whenever stress occurs, this increases these hormones like epinephrine, cortisol, and they increase the need for insulin. So as you mentioned, that people who are susceptible to develop diabetes over a period of time develop diabetes because they are constantly in a higher requirement for insulin over a period of time. That leads to several various changes and ultimately leads to the development of diabetes. So stress is becoming an important risk factor for diabetes over the years. Although we know that there are other risk factors, but stress is becoming an important risk factor for development of diabetes in many countries across the world.
Definitely. So we'd like to study this in a little more depth. Dr. Sanjay Agarwal, like Dr. Rakesh has said, it's leading to diabetes. How does chronic stress affect human health in relation to diabetes?
Thank you, Richa. I think that's an excellent question. Today, I don't think there is any single person who's not exposed to stress, right? It's a common factor that sort of rules our lives. But do all patients develop diabetes? That's a key question, and I'm sure we'll be addressing this during the course of our panel discussion. But what happens is, as Dr. Rakesh just explained to you, that due to stress, there is a lot of increase in the stress hormones. And whatever sort of insulin is produced in the body, it's not able to function very well. It's a state of insulin resistance, and that sort of predisposes somebody to develop diabetes. Now, add this to the fact that when patients are under stress, they have bad eating habits. They may sort of have all the wrong kinds of food, and they may have a lot of high carb food. As it is in our country, we are a carb eating nation. But, because of stress, they may have all the wrong eating habits. This also contributes to the weight that an individual tends to have. And, with the weight gain, it only worsens the whole situation. Now, when people are under stress, they're not exercising enough. And, they tend to be more sedentary, more sort of, stuck to their chairs. And that sort of contributes to the weight gain that may happen. So put it all together, the increase in stress hormones, the insulin resistance, bad eating habits, weight gain, all these sort of contribute to the increased risk of developing diabetes.
I'd like to go to Dr. Vijay now. Dr. Vijay, what is cortisol and how is it related to stress and diabetes?
Thank you, Risha. As you heard from Dr. Sanjay Agarwal and for that Dr. Rakesh Sahay, cortisol belongs to what is called counter-regulatory hormones. They are having the exact opposite effect of insulin. So if you look at a balance, the balance is tilted towards cortisol on the counter-regulatory hormones, the anti-insulin hormones. And when the balance tilts, you get stress using diabetes. So it is like it is an counter-regulatory hormone, anti-insulin hormone. And whatever insulin tries to do, insulin is deficient. Insulin, as you heard from Rakesh, is not effective. It's not active. So, and cortisol will exceed glucagon, cortisol, and epinephrine, and so on. All the counter-regulatory hormones will dominate and produce diabetes.
So, Dr. Sahay, in today's times, almost everybody has low or high levels of stress. And how does it impact our blood sugar levels?
Yeah, so basically, Dr. Sanjay has just explained a few details about this. But going a little deeper into that, what happens is that whenever there's stress, there's a flight or fight reaction. You react to stress and you have increase in certain hormones like cortisol, epinephrine. These are hormones which are released from the adrenal gland. They actually are helping you to cope up with the stress. But during that period, what is happening is that they are increasing the need for insulin. So people who have this, their blood sugar tends to go up, but it doesn't go up in everybody. Their insulin secretion increases, and that counteracts the need. I mean, that keeps the blood sugar normal. So stress at one point of time may not cause diabetes, but chronically over a period of time, when the insulin levels are high, this insulin, tends to keep the glucose levels normal, but the high insulin is having other adverse effects. It is having effects on the lipids. It is causing the blood glucose, blood lipids to go up. And then it is also activating the coagulation pathways. It is activating the immune system. And all these other, and inflammation, all these other pathways are activated. And so what is happening over a period of time is that there is a state of insulin resistance. That is, this more amount of insulin is required to produce the same action. And so the pancreas are put to strain, and more and more insulin is required, and people are going on with their lives with all this disturbance happening. But over a period of time, the pancreas is not able to keep up to this increased demand, and once it starts declining, the pancreatic function starts declining, or the insulin production starts declining, then the person develops diabetes. But over that period, he has developed several other problems. He has gained weight. He has had changes in his blood lipid levels. His coagulation pathways and all that has been affected, because of which there's increase in the clogging of the blood vessels. All these are happening, and finally diabetes develops. So that is how stress contributes to the development of diabetes over a period of time.
Right. So in that case, if stress remains unchecked in chronic cases, it actually leads to development of diabetes in most of the cases. Is it fair to say that, Dr. Sanjay?
Okay, I think I'll follow up on my answer that I gave earlier, that why do some people develop diabetes when they're under chronic stress versus those who can handle stress much better? Now, remember that diabetes is an epigenetic phenomenon where we need to have a certain element of genes that makes us more prone for development of diabetes. There are certain high-risk factors that an individual may have, which are environmental factors. For example, bad eating habits, obesity, family history, and presence of other non-communicable diseases. So these are sort of high-risk situations which somebody tends to have, which makes them more prone for development of diabetes. So we need to have the genetic makeup, which increases the risk for development of diabetes. Now, add that if you have chronic stress and the mechanisms that have been outlined by Dr. Rakesh and Dr. Vijay as to how diabetes develops in these individuals, it's a perfect conundrum where we have all the constituents which will increase the risk for diabetes. So that's the reason why some people have an increased risk for diabetes versus those who can handle stress much better. Possibly a lot of depends on what is the genetic makeup of an individual, which sort of increases the risk for development of future diabetes.
So that puts in spotlight the management of stress, which is emphasized upon these days a lot. So, Dr. Vijay, if we are able to manage stress levels effectively, can we prevent diabetes?
Yeah, certainly studies have shown that if you reduce stress, you can reduce the risk of diabetes. As you heard from Dr. Sanjay, the bullets are already loaded in the gun when the person is born. That's the genes. Now, what pulls the trigger is the environmental factor, and stress is one of them. So you don't pull the trigger, the bullets will remain inside the gun, won't come out. So you can prevent diabetes by controlling stress. Certainly, yes.
Also, I want to talk about mental health, which is of a lot of importance these days because it has become an issue. How does mental health affect the development of diabetes related to stress, Dr. Rakesh?
Yeah, so I think this has also been a focus of a lot of research in the past few years. We have had a lot of studies being done on understanding how diabetes is affected by depression. People who are depressed tend to have more risk of developing diabetes, and those who are diabetic tend to have more depression because because of various factors, the problems that are associated with diabetes and the way they cope up with the diabetes. So all this has an impact on causing more of anxiety, more of depression amongst people with diabetes, and those who are depressed otherwise also tend to develop diabetes. So this is seen to be a bidirectional relationship, showing that depression has a significant, or the mental makeup of the individual has a significant impact on the blood sugar levels. And that is that is important, and we need to see how people adapt to diabetes, how people adapt to the stress that they are dealing with, and if they're able to do it well, they have less of these hormones that we spoke of, the cortisol, epinephrine secretion, and all that can be reduced by people adapting well to the stress and to the circumstances around them.
Right. So I'd like to flip this now. Dr. Sanjay, if stress is leading to diabetes, does diabetes also increase the stress levels?
Yeah, surely. I think, ask an individual who really suffers from diabetes. His main anxiety is, how do I keep my blood sugars in good control? And given today the challenges of day-to-day life that an individual has, people are rushing to work, they have shifts, they are unable to cope with their financial needs, they have a lot of other sort of commitments in life, and time frames of, eating are very poor. Now, given all these in the background, if we are sort of advocating them certain forms of treatment, then you find it very challenging to sort of, put this all together. For example, they may need to have certain timelines of when they should eat in the day, the meal composition that will help them to keep the sugars in good control. We do advise them that, daily exercise is very beneficial for them. People who are on insulin, they should not ignore the food habits that they're supposed to follow. And there's always a challenge of somebody going low in terms of their blood sugars, which can make it very difficult for them to function. And this is more true for either very small children or for the elderly population. Now, people are on shifts. They find it very difficult to match their meal timings as well as their, drug dosaging that they have to do. All this sort of leads to very bad control, a lot of fluctuations in the control, and over a period of time increases the risk of development of diabetic complications. And once diabetic complications happen, then it is a kind of a progressive problem that the person has to deal with, which affects their functionality more. Now, imagine a situation where in India, we are seeing a higher prevalence of diabetes in the second and third decade as compared to the Western population. And people in the productive years have to sort of deal with these challenges. It just makes their lifestyle extremely stressful, and they find it very difficult to cope with diabetes.
Right. We talked a little about lifestyle here, but I'd like to ask Dr. Vijay, what are the major lifestyle changes you would like to suggest to reduce stress and the risk of diabetes in India?
Richard, if I can add one point to what Dr. Sanjay said, there is a specific syndrome called DDS, diabetes-related distress syndrome, and it's a 17-point questionnaire, and we were the first in India to publish this. DDS, after us, some publications have come. So DDS is a diabetes-specific 17 questionnaire for finding out stress due to diabetes. Now, coming to your question, so the point is you should exercise. You should not find an excuse for doing exercise. You should get out. You can do exercise for 30 minutes. We're only asking you to do it for 150 minutes a week, not more than that. And we're telling you to reduce your weight, which is not very difficult. And we're not going to ask you to reduce 100% of your weight, only 10% of your weight. So reducing 10% of weight by regular exercise, eating less, walk more, it's all easy. And reduce stress. Don't think about your children getting into medical college and so on, so on, so forth. So, you can reduce stress, you can walk more, eat less. Don't eat at all times. Eat at different times, only when you need food. Just because food is there, you shouldn't eat it. So that's a lifestyle advice I would give. Thank you very much.
I think that's a very valid point. Eat when you're hungry, when you really need it, not just for the sake of it. Dr. Rakesh, how does stress affect our eating habits, our weight, because it's also related to diabetes?
Yeah, I think Dr. Vijay brought out a very important point that, when you eat during the day is also very important. It has been seen in various studies. People have looked at, two groups of people eating the same amount of food. When they're eating at, odd hours, eating in the night, those who are working in the night shift, eating at night, snacking at night, they tend to, even with the same amount of food, they tend to gain more weight. They end up with being overweight. They end up developing diabetes. They have more of stress. If you look at the stress hormones, the growth hormone, the cortisol, all these hormones, if you measure in them, you find that these hormones are higher and they develop diabetes more than people who are eating on time. So this is very important, eating right and eating on time. So the food choices are very important. And people who are stressed tend to make the wrong choices. They tend to eat more of these high calorie foods because they feel that they don't have time for their food, and they don't have time to decide what to eat and eat proper. They're worried about so many other things. So that's where people make wrong choices of the food that they're taking. They're eating more of carbs, eating more of high fat food, and less of protein, and this is what is causing a problem for these people. So that's what exactly Dr. Sanjay and Dr. Vijay also alluded to this. And so I think that's very important, that we make the right choices in the food and eat at the right time, so as to see that we don't develop diabetes. And stress has this adverse impact on both these aspects.
Right. Thank you so much, all the three panelists, for being with us, for sharing your valuable time. It's been a very enriching, informative discussion, and I'm sure people who are dealing with stress would be more educated post this discussion on how they can manage their stress levels and also reduce the risk of developing diabetes, especially type 2 diabetes. I would like to again thank all our three esteemed panelists for coming on this show and sharing this valuable knowledge with us. Thank you once again.
Thank you.
Thank you very much.
Thank you.